Scan through my slides real quick. Sound good?
What did you have for breakfast?
What did I have for breakfast? I had a very nice breakfast at the hotel. Cereal, fruit, some eggs. It was very good. And lots of coffee.
Awesome. I think we're good.
Cool. Hello.
How's it going?
Very well, thanks. Yourself? Oh, we are. Oh, terrific. Good.
Oh, we're recording and streaming.
Yeah, I was going to say the live streaming I knew about, but I didn't know about the recording. So this is exciting. I'd love to have a recording so I can
We'll put all this online.
show.
We'll share it with you.
Nice, cool.
All right, can you try like moving?
Oh, moving to over here.
Yeah. Okay, honestly, the wireless mic seems to be picking up all of it just fine.
Okay, good. Awesome.
So,
I think.
Larry.
Yeah. Well, Lauren's on my tag, but you can call me Larry. It's fine.
One of the from OHSU up in Portland has graciously agreed to come down and be our presenter on, sorry, that was a very long title, implementing a course evaluation system at Health Sciences University, lessons learned. And I'll hand it off to you.
Great, thank you so much, Raul. So that question box over there, that's actually the microphone for the questions. So if you have a question so that we can pick it up on the recording, please grab it, talk into it, all that good stuff. So welcome everyone to my presentation today. I'm glad you took time out to join in the fun. So my name is Lawrence Williams. I'm from Oregon Health and Science University. And this is a talk that I developed with the assistance of lots of folks over the course of a couple years in terms of what we learned in terms of the implementation of our course and teaching evaluation system at OHSU. And so it's not a super technical presentation, but I think that's okay. And so we can talk about it kind of after I get through some slides. The agenda for today, real quick, I'll do some acknowledgments and the little introduction. Talk a little bit about the OHSU context of, OHSU, at the risk of sounding like special snowflakes, it is a health sciences university, which makes it a little unique than the traditional kind of undergraduate, graduate liberal arts institution. Talk a little bit about our course and teaching evaluation system, which is called BLUE, and then what we've learned through the process of implementing BLUE at OHSU. So a few acknowledgments. First and foremost, Dr. Tanya Ostrogorski. She used to work at OHSU, now works at OSU in the College of Pharmacy, so a joint program that we have between the colleges. A fantastic educator and mentor. I had the great pleasure of working with her when I first began at OHSU, and many of these slides are influenced by her and use her data. So I want to give her big, big thanks for allowing me to do that. And of course, my Teaching and Learning Center team for supporting me. Thank you so much for being here and for being such great mentors as well throughout this past couple years. So a little bit about me. That's me. I just won a bunch of pretzels. I was really happy. And I had a lot more hair back then, so it was pretty terrific. I started as an intern at OHSU several years ago, and then my department had an opening, and I was hired. And I show this slide not because I want to portray myself as super cheeky, but that there is a human being behind the evaluation system. There is someone who will answer emails, who will answer phone calls. It's not gremlins in the background or some scary big brother type of figure looking at evaluation data. It's this clown right here. And so I want people to feel comfortable with this and make it more a human process because really we're trying to implement a culture of evaluation at OHSU. And it's not something you can do if you feel like you being the faculty or administrators, that it's a system run by robots or a barrage of monkeys in cages. So let's get a little bit of context of OHSU. In case you haven't been to Portland lately, or at all, this is the Markham Hill campus. It's in a slightly older photo because you don't see the towers in the south waterfront yet, but this is OHSU. It's a medical university with schools of nursing, dentistry, medicine, School of Public Health that we share with Portland State University, as well as a College of Pharmacy. It is also a medical institution, so we have several hospitals in this campus, not just one. So it's even though it's not a huge area of Portland, it's got a big reach because we have reach across the United States and the world. So we have campuses, remote campuses, primarily for nursing across the state of Oregon. We also have fully online programs as well. Through the RN to Bachelor of Science, RN to BS program, as well as some of the biomedical informatics programs are fully online. And OHSU that has this great reach out to all these different people, and we needed an evaluation system that would, of course, in teaching evaluation system that would capture all these needs. And so how did this process start? So back in 2012, our then provost was asking questions like, and also our creditors were asking questions saying, what is your average response rate for your course evaluations? What is the average rating of your courses in a particular school? guess what? We couldn't quite answer those questions, not easily, because there was no systematic way of collecting the data and then reporting it. There was no one system that we were using to say, yes, our school of nursing has X amount of students responding to evaluations, and here is the average rating of the courses, and then here are the instructor ratings as well. Couldn't do it. I mean, school of nursing we could because they were really good about it, even proactively, before implementing Blue, but not all programs were at OHSU. So we built a survey item team which reviewed all of the surveys and evaluations that were being sent to students to review the questions, do an item analysis of them. And then we had a technology and vendor selection team which reviewed all the tech solutions out there. Long story short, after much vetting and review of companies, we settled with Blue. Blue is a product that is offered by a company called eXplorance. Their other products are green and red, which I find just very amusing. But we selected Blue for many reasons, but there were 4 that really, I think, stood out. Its product focus, number 1, is that it is pretty darn good at doing course and teaching evaluations. It really excels at it. You can also build surveys within it as well. So if you're looking for alternatives like Qualtrics, for example, that might be an alternative for you. It's affordable for what it does for the institution our size. It's affordable. It is also scalable, which is also great because if OHSU suddenly blossomed from 2,000 to 3,000 students to like 10,000 students, which is unlikely, but you never know, it can grow to accommodate that. It interfaces with Banner, which is our student information system, our SIS, which is fantastic because Banner is the end-all be-all for Blue, and I'll touch on that in a bit. And last but certainly not least, it is mobile-friendly and is ADA compliant, so it works well with screen readers and other assistive technologies. And if you use a smartphone, a tablet, a laptop, whatever, if it can connect to the internet, you can connect to your evaluations. As a student, you can connect to your reports as a faculty member. So I won't get into the nitty-gritty of how it works because that's a whole nother presentation. It's really boring. Long and short of it, Banner feeds information to Blue. Student information, instructors, courses, all that good stuff. And then Sakai, which is our learning management system, is the pathway to get to Blue. So we use a single sign-on authentication system called Shibboleth. Students log into Blue, or log into Sakai, excuse me, and then they get to their evaluations, along with their courses and all sorts of other good stuff. For faculty member administrators, it has really great reports available. We can tell how many students have been invited, how many have responded. We can get averages. It's really fantastic. I will get to this slide later, though, because there are some trouble spots in it. So we've been using the system for about 4.5 years now. And we have the technology mostly down. There have been a couple upgrades. There's some additional tools that we can purchase. There's room for us to grow and expand and try new things. But again, we're feeling good about it. However, our needs are shifting. Things are changing, and we've learned things along the way. You know, there's areas in which we can improve. And so that's really I think the meat of this presentation. So there's 4 lessons, and the first one, no surprise, we have to keep our data clean. Because one of the things that happened, Banner, remember, Banner sends all of our information to Blue. And forgive me for the very small text on this slide, but there's 2 columns I want to point out. J and L here. J is empty. L has a hashtag name ? This means that this course in particular, this school nursing course, has no department listing at all. So it's an orphan course. It's not listed with the school. It's not listed with the department. It's just floating out there. It was set up for evaluation, so students, when they logged in at the time evaluations were due, it was present. They completed their evaluations, which is great. But take a moment. What is the problem, or one of the problems, with this course not being associated with anything? Yes, the stats. The averages for this department will be wrong because the calculations for this particular course will not be included in that because it's not affiliated with anything. So not only is it wrong for the department, it's wrong for the school. So the overall stats for the school in terms of the means, averages, et cetera, how many students responded, what were the ratings, et cetera, will not be correct. Which leads me to this. So these subject and department averages will be off. Also, another reason why we need to keep the data clean, so these are other courses too. It wasn't just a school nursing course, but public health, medicine, et cetera, both had these issues. So these subject and department averages will not be quite correct for both that particular department, nursing, for example, but for all of them, for nursing, for medicine, public health, and so on. So suddenly your data is not quite as good as it should be. So that's a big reason why data needs to be kept clean. So we proposed an intervention. And this is what we've been doing kind of the first year when we implemented Blue, this was a huge problem because the data wasn't being kept clean. And then, Blue is like the canary in the coal mine. It's saying, hey, something's not quite right. And it really wasn't. All these folks are in various programs, various schools saying, what is wrong? We've got departmental reports for departments that don't exist anymore. Why is this the case? Well, they exist in Banner. They're still hanging out there somewhere. So a couple things we did, myself and Tanya and other team members at OHSU, we scheduled quarterly sessions with the ACAD team. And this is the team that work with, they're not necessarily all registrar employees, but they work with the registrar's office as well. They manage Banner records. And so each quarter we will meet with them to say, hey, how are things going? Just a reminder that to keep your records up to date. We'll maybe share reports with them to say, this is what's coming, this is what's in Blue. Is this what's correct for you? Is this for your departments? We'll send reminders every quarter to them. In addition to face-to-face meetings, we send emails saying, hey, now is a great time to review your data. It's a little bit slower part of the term. Maybe you should check in on it and let me know if there's any way I can help. Also, collaborating with ITG, and forgive me I didn't spell this out, ITG Information Technology Group. It is our IT department for both the university and the hospital. And they have developed some fantastic reports. Banner's not always great about the reports it can generate for users, but the ITG team has worked with ACAD, worked with the registrar to develop reports, I believe in Discoverer, that are fantastic and quickly produce lists of courses that may have errors, or instructors that may or may not, or should not be slated for evaluation. So they're creating shortcuts, essentially, to speed up work. So lesson number 2, and I'm sure you've heard this at your various institutions, is evaluation fatigue. Students are tired. They're so tired of evaluations because they're getting so darn many of them. So we... one of the things that I learned and Tanya learned as well is that not only are our department, the Teaching and Learning Center, sending out evaluations for end of courses, but so are all the programs. Various schools are doing their own internal evaluations. Heck, some of the student groups are doing their own evaluations of how things are going. And so students are being bombarded with surveys, throughout the quarter. And we're on a quarter-based system. Not just the end of course, AKA provost level evaluations. And so the end result is they're not doing them, a lot of the times. They're just overwhelmed, like, I can't. This is not a time that I can do evaluations. Or they're very, not glib, but short in their responses. They'll maybe fill out the quantitative sections and not add any comments. So some things we did to address this issue. It's not a cure-all, it's not a silver bullet. That we're definitely working on this because this, I think, was one of the number one issues we continue to come across is survey fatigue. But being more mindful about when we send out evaluations, so for School of Medicine, not sending evaluations out during the USMLE Step 1 exam, which is a big exam that the students have to take in their process of completing medical school. During the prep time for that exam, not a good time. And during the day of the exam, really not a good time. So sending it at break times or other periods in which the workload's just a little bit lower. Also, combining evaluation projects. So our UME, our undergraduate medical education program, The preceptor evaluations, we've combined those evaluations with our provost evaluation. So adding those questions into one instead of sending two, maybe even three evaluations per quarter. They're a little longer, yes, but the students do appreciate that. It's just one evaluation that they have to do. And the reporting in blue, we can split it out so that the preceptor questions can be in one report, you and me, end of block evaluations can be in another, and in some reports they can be combined. Depends on who the audience is. Blue has that flexibility, which is great. And last but certainly not least, question in the back. Sure. Oh yes, if you can use the box and go ahead and throw it.
So my question, you talked about preceptors. Is there something not just for the students to evaluate the preceptor, but the preceptor to evaluate the students? I mean, vice versa. Do you see what I'm saying?
Yeah, that's a really good question. We currently, yes, there is something in place. No, it's not being handled at a university level because each school is doing it slightly differently. The School of Medicine uses MedHub, I believe, as their preceptor evaluation tool for the preceptors to evaluate the students. School of Dentistry and the Physician Assistant Program, PA program, they are using CourseEval for that small bit of evaluation. The end of course and provost level evaluations, those are all done in blue. That's a great question though. I'm not involved in those evaluation projects just because again they're handled within the schools. I think eventually it will be handled by the provost office, but that I think will take time, to win folks over and also demonstrate, hey, if you let us do it, it's a lot less work for your individual programs. Which again kind of leads to the last point though of increasing the dialogue between the Teaching and Learning Center and Provost Office and the individual schools, really assessing their needs and kind of what the calendar of their staff, faculty, and students have. Again, just really be mindful of when are peak times and when are low times, when are easy, good times to send evaluations and when are like the absolute worst times to send them. And really, if it isn't relevant, if it isn't actionable, do you really need to send it out? And that's one of the questions we're getting to with a lot of folks, faculty, staff, programs, and even the provost level. Because if we're inundating our students with evaluations and not doing anything with them, not only are we helping promote evaluation fatigue, we're also telling our students, you're telling us stuff, but we don't really care. And that's a big problem because that's like, I think, one of the second or third ways in the evaluation literature. If you want to get students to do evaluations, demonstrate how you're using the data. And I'll touch on this in a little bit. But if you don't use it, that's like doubling the effort to make the students not do it. So again, if you're not going to do anything with this data, don't send it out. And that's again something that we're asking ourselves over and over. It's not just like one time, like, okay, check mark, cross, we're done. It's constantly reviewing, like, okay, is this item really necessary in this evaluation? Are we getting the data we need from it? And sometimes, yes, we have to ask certain questions, to meet accreditors' guidelines. Like there's a specific item they need to know, and so yes, we have to include it. Other times, we don't have to, so there's a little bit of flexibility. So lesson number 3, I'm sure this comes as no surprise, is privacy, is a big issue for our students. I think OHSU, again, is unique in that it's a health institution. Obviously, we have to keep FERPA regulations and rules in mind, which we do, but we also have to keep HIPAA regulations in mind as well. Sakai and Blue are not places where HIPAA data can go, which is fabulous. We don't have to worry about that. However, it is secure and set up and has met our security guidelines. If in the event HIPAA data ever did get in there, it would be handled appropriately. But, this doesn't always happen in undergraduate institutions, but at OHSU, and certainly the rural campuses, students may end up working directly with their instructors down the road. Students really do need those letters of recommendation and those endorsements from their instructors to proceed to the next step. So students may not feel comfortable associating their name or any of their identifying information in the evaluations. So a couple things that we've done to address this. So although the term is flexible confidentiality, long and short of it, it's an anonymization, of all evaluations done at OHSU. Not even I, the survey administrator, the Blue administrator, can sync a student to her or his evaluation results. All the data is anonymized. There's no way I can match that. And so I tell this to faculty, I tell this to staff and to students, to say your data, it is anonymous. And I will not try to link your evaluation results to students, nor could I if I ever was tasked with it. I just simply cannot do it. And then this is a quote, an actual quote from an OHS student. OHSU, get out of my phone. So there's a big push at OHSU, I think, in several departments to say, let's just build an app. We'll build an app and like they will come and they'll fill out stuff and they'll get the information they need and yada yada. Great. We should explore mobile technology a lot more than we currently are. But students are very mindful of OHSU tools on their mobile devices because extra security is in place because of, again, of FERPA, of HIPAA, of all sorts of regulations. Also, some of these technologies, such as, which may seem very mundane and innocuous, are like for our movement around campus to track our steps every day, which is, yeah, you shouldn't know that information, but that also has the implication that they will, someone managing this data could know your routes to and from work, where you go, anywhere else if you have your phone on you. So yeah, data is a big thing at OHSU, as is the privacy around it. And so many students at our institution are very reluctant to add additional applications in which OHSU can infiltrate their technology. Infiltrate being, I think, their word. So again, just being mindful of all these potential issues with evaluations. And last, but certainly not least, is just acknowledge that this is a cultural shift. Whenever you're implementing an evaluation system, a learning management system, a change in your student, your SIS, there are cultural changes that accompany this sort of change, and that you need to prepare for it. And it affects everyone, your faculty, your staff, your students. It touches every part of your institution. So at the very beginning, we had to create confidence in the system. It's like the system had to be successful right from the get-go, and it was, knock on wood. But how do you define success? Success in that it didn't crash, and it did what technically it was supposed to do? Yeah, it was successful. Was it successful in incorporating faculty feedback and making faculty feel empowered? Not so much. And that's where we kind of failed, I think, in this particular instance. Because you can see from our second bullet point, many programs and many schools suddenly felt like they had no autonomy in evaluations. It went from being a school-based, sometimes even program-based, review of how the evaluations were done and implemented to students, to being the provost office driving that decision, and all control was taken away, and power or access to reports and access to data was then very much restricted. So many people across the institution felt like putting hands in the air, like, well, what am I supposed to do? Who do I go to? When do I know when evaluations go out if I'm not sending them? Are evaluations going out if I'm not sending them? And so, yes, marketing and promotions were built for Blue to send out to programs, to send out to staff. But not enough, I think, was done. Also, the audience that we were trying to reach of program assistants and ACAD data managers and things like that, that has a high churn. So a lot of these folks leave after a year or so. And we all know when people leave, they take their institutional knowledge with them. And sadly, Blue and evaluation programming and how Banner influences Blue, that knowledge is not always taught with those incoming staff. So yes, again, we created a confidence in that the system works, but there was a lot of hemming and hawing and weeping and gnashing of teeth in terms of these other items, which now down the road we're trying to fix. So how are we trying to fix it? Back to me. So I've been on this kind of one-man show, which is gathering more people as a result. A lot of smiles and a little self-deprecating humor goes a long way when you're working with doctors and nurses who are educating folks and saying, hey, this is important, this is really relevant, and hey, I'm here for you. And that is a message that not a lot of people hear at OHSU, just because we're all very busy. And that's fine, we're all busy, but not too busy to be nice to one another. And I think, reminding folks that, like, I'm a human being here to assist you. Again, as I said earlier in the presentation, it's not gremlins in the background running the evaluation system, it's me. It's this clown with the pretzels. So a couple of interventions that we provided, or that we're building in several different groups. So for the students, one of the ways we're trying to address survey fatigue and hopefully improve quality of surveys, of evaluations, for courses and for faculty, is to share what we're doing. To say, hey, be more transparent about the information we're sharing, or sending, or collecting, To say, this is your feedback is helping us make decisions. And so for one example, nursing programs, primarily graduate nursing programs, they are in their course syllabi, they're listing some of the changes that they've made. So like instructors are writing, based on your feedback, we have done X, Y, Z. And then also saying, in courses, saying, thank you for your feedback, especially if they do midterm evaluations. Not all programs do, but nursing does sometimes. To say, hey, you gave us feedback. That's terrific. Some of the things we can't fix now, but we'll be more mindful of in the future. That's actually really powerful. It seems like, pat language like, oh, yeah, we'll get to it. But if you're sincere about it, and I hope you all are when you talk to students about evaluations, that really does help bolster evaluation response rates. Also, letting students know, reminding them that, hey, when you're evaluating your instructors, this data is used for their promotion and tenure. This helps them become better teachers. So please be mindful of that. Be constructive in your feedback when you're giving feedback. Hopefully you do give feedback. And that these two items, actually, I will say, has shown a 10 to 15% response rate increase in school nursing evaluations. Just this act alone of saying, reminding them of these changes of the students. Preferably by the instructor. And the instructor touch in evaluations, that is one of the most powerful ways students can to improve response rates and response quality. Also, adding information in the welcome pages and the emails that go out to students, in the reminder, or invitation and reminder emails, letting students know that there are ways to, I don't want to use the word complain, but to state concerns. If you, the student, have an affirmative action concern, a Title IX type of concern, if you want to speak with someone in a private way, and or elevate an issue that you saw in the classroom, there are ways of doing it. Course evaluations probably isn't the best though, because hopefully someone's looking at your evaluations, but sometimes students may put these sorts of complaints into an evaluation and feel like, okay, I've done it. I have reported this issue. I'm good to go. But if that comment, if that notice of something happening in a classroom isn't seen by anyone, then no one can act on it. No one can change the issue or follow up with the student. Well, they can't follow up with the student because the survey is anonymized. But what we started doing to address this issue is put the OHSU Ombudsman, the AAEO office, and accessibility offices and Title IX offices, put their contact information to say, hey, if you have an issue that you need to report, here's who to contact, and they can assist you in ways that this tool is not really built for. Because we want to know if there's something going on. We want to know so that we can, hopefully fix it and fix it quickly. And then also, again, I just touched on it, but giving some instructions to students on how to give constructive yet critical feedback. Because we're not all delicate daisies. We do need to hear some hard things sometimes to improve our teaching practice. But there are ways to say it without being cruel. So forgive the small text, but this is a sample of one of the welcome pages that we're going to be piloting for the School of Nursing. So it gives some instructions on, hey, thank you for doing this. Here's how we use your evaluation data. And then here's some ways you can give good feedback. So this first item is, hey, be respectful in your comments. And derogatory comments don't help us. So saying that your instructor has like a nice dress or has funny hair, that's not helpful to anybody. And then we give examples. So this is an example of a disrespectful or not specific comment. The instructor should retire. This happens a lot at OHSU, this particular comment. So a respectful and specific example is, sometimes class sessions were confusing and disorganized. It would be better if the instructor had clear objectives and followed them so that the students knew what the session was about and wasn't so confused. Okay, still hard to hear, it sounds like, okay, there's room for improvement, but it's not mean, That comment, I will say again, that instructor should retire is one of, it happens a lot and it is so hurtful. So many instructors, once they get that, they stop looking at their evaluations reports, and it's a shame, because that's not always the case. So this again is just one example of a method we're trying to implement to show, hey, there's ways to give good feedback, and here's some examples on how to do it, and then the importance of it. So we're doing outreach to students. We're also doing it for instructors as well. So one of the I think weaker points of Blue is if you have access to a lot of evaluation reports, they all kind of look the same after a while. And the page, and I didn't take a screenshot sadly, but the page to retrieve them can fill with a laundry list of links that all look alike. And so reminding folks that where am I? That this clown can help you find the data that you need very quickly if need be. So just putting that message out there over and over, like, I can assist you, I'm here for you. And also, again, through this presentation series that I've developed, just to put the message out there that I can help you find your evaluation reports. If you need help with interpreting your reports, I can also look into that. And if there's any particular issue with the data coming in from Banner, I can also help either fix it if possible or triage it to the appropriate person. Because sometimes the faculty member may not know who is responsible for handling their courses records in Banner. That's actually pretty common. And that makes sense because OHSU is a pretty big place. And so, and again, with high churn in that kind of pool of employees, you may, it's like, oh, it's the new Becky is doing it. And it's like, well, who's she? And et cetera. So I can help kind of negotiate that. So in general, again, trying to continue foster that climate of trust, the climate of confidence, and just saying, I'm here for you, et cetera. And I think doing that is part of that is a high response time to evaluation questions and emails and things of that nature. I really try and get in touch with people within an hour, if possible, by phone. Well, by phone by 15 minutes, but within an hour for email, or at least one business day. I do try and say, hey, I'm working on your issue. Thanks for letting me know, et cetera. I personally feel like if I let things linger, people will stop. They'll just say, forget it. It's my email's gone into the void of the provost's office. Like no one will ever respond. And I'm again really trying to combat that idea. So this is more of what I'm kind of sharing with you all, and you may not already know it. If so, great. But if not, just some things to keep in mind. So lesson number 1, you keep your data clean. It will make you so much happier in the end. And if you don't, it's not, and you have to keep it clean. It's not just, you do it once, you're like, all right, I'm good. That's awesome. It's a process you have to do over and over. Number 2, be mindful, again, of survey fatigue, of your evaluations. How often do you send them out? When are you sending them out? Are you sending them out at peak times? Or are you sending them out after students have already left the program? Sometimes school nursing programs, they end just a shade earlier, and if we send them out after the students are gone, forget it, they're gone. So, just again, being really thoughtful of that, and being thoughtful of, can we combine our evaluations? Are we asking questions that really absolutely need to be answered, or can we omit them? Because if it's not relevant, if it's not actionable, don't include it. And number 3, address privacy concerns. I'm sure you all already know that, but do keep all those issues in mind. Again, for some of those who came in late, you may have missed the slide where there was a bit called OHSU Get Off My Phone, and students are very mindful of school-based applications that they can feel that they're tracked or that their information may be monitored in some way. So just be really thoughtful about that kind of stuff. Include student feedback, and I should have said that earlier. Include student feedback as much as you can. But that's another thing we're trying to do is get some student focus groups involved in evaluation to find out, how can we improve things for them. And last but not least, always be aware of the cultural implications of implementing this sort of system. It's not just the technology that you're changing. It is the way things are done at the organization. And some people may really love it or really hate it. And odds are people may be negative depending on what's being done. And so just to be really mindful of those sorts of things. And I think including faculty as much and as early as you can is terrific. We didn't quite do that as well as we could have and should have. And we're kind of like working on that now, rebuilding that trust, rebuilding the marketing plan, and letting folks know that there is someone out there who can provide assistance with evaluations if assistance is needed. And so I've been talking a whole lot, and so I welcome any questions. Again, the question box is that orange box there. If you can toss it to whoever has a question so that we can pick up for the live stream. And so they can hear. So, and yes, you can toss it around. It's pretty
I guess
cool.
I have more of a technical question regarding.
Okay, I'll try and answer.
Okay. So, the interface between Sakai, is Sakai the delivery method of Blue?
Good question. It is not the delivery method. It is, think of it as the portal to get to Blue. So the delivery method is a couple ways. We send out primarily email through Blue. The evaluation system itself has an email tool built within it. So we send introduction and email reminders. So the intro, evaluations open, emails are pushed out saying, hey, students, do your emails, or do your evaluations, excuse me. And then if they don't do their evaluations within a couple days, a reminder goes out to them, also through Blue. And then if they don't do that, again, another reminder goes out. I can also manually add reminders as well. So some programs, they ask evaluation reminders go out every 3 days if students haven't done it. So the email contains a link that points the user to Sakai. And again, OHSU has a single sign-on setup. So they log in with their OHSU credentials, and Shibboleth is our authentication system. So Shibboleth recognizes them saying, okay, it's this person, and then they arrive at Sakai. And then through Sakai, they click through, if they're a student, they'll click through to the evaluations page, and they'll see the list of evaluations. Then they click on there, and then that then takes them to Blue. So, and then kind of the same process for faculty, except faculty will see reports, not evaluations. But again, Sakai is the portal to get to Blue.
Okay, thank you.
Yeah. Oh yeah, of course. Please.
So do you use a ticketing system to interface with questions? Thanks.
Oh yeah, that's a really excellent question. We have a current ticketing system that we use for Sakai. So the department I work for manages our learning management system. We do use a homegrown system that we are phasing out because it is not quite stable. And so we're looking at other systems at the moment. And that system, we hope to not only have inquiries sent for Sakai, but also for Blue. So long answer short, yes.
So you're kind of streamlining, like having one central ticketing system to address all of those inquiries.
Yeah, and we not only will we have them coming in, but we also tag the tickets that come in, and so if there's any like evaluation related tickets, we'll flag it as such. And also from the source, whether it came from a student or faculty, and then what school or program it came from. So that way we can then build reporting to say, hey, in this quarter, we had this number of faculty and this number of students send in issues about evaluations. Also, when they can tag it for evaluations, we can tag it for additional items. So it's evaluations and they had trouble logging in, or evaluations and they were missing a course, so things like that. So we can get a little more granular as a result, which is good because then we can go back to programs and say, hey, something's not quite right with whatever's going on. So or to the registrar's office to say, hey, something's broken, let's take a look at it.
Okay, and I have another question.
Sure.
So you indicated that the evaluations were disseminated per school, but now efforts are more central?
Yes, so prior to Blue being implemented, which was the fall of 2013, and I should put that date in my slides, that was the date when it was like, all right, we're live. The evaluations are now through Blue. Prior to that date, evaluations were handled by schools or programs if they were done at all. Some schools or programs, they may have been done by paper, or they just weren't done. So, so it was a hodgepodge of things. A lot of shadow systems being used, if any systems. So pen and paper sometimes was being used. School nursing, they use Sakai's. Sakai has, although it's I think being sunsetted, an evaluation arm to it. So you can turn on that tool. It's not great, but it's okay. If you don't need to do longitudinal reporting, it's fine. You could certainly use it for that. Although the interface as an admin is very cumbersome. One of the reasons why we didn't go and just continue using Sakai's evaluation tool for all schools is that it doesn't do longitudinal reporting, and Blue does, and does it well, and it does it fairly easily. So,
Okay, thank you.
yeah, of course. Any other questions? Okay, I'll take that as a no. We're going to end it early, so you've got 5 extra minutes to get some coffee and party and talk to vendors and get some Met money. So thank you all for joining today. Thank you, Northwest Met, for letting us participate and doing this thing, and I hope you have a wonderful conference. Thank you.